announcements because I find them so great. And then I'm like, well, I got to actually record at some point.
Yeah.
Um,
And Mark, before we start, is this okay sound wise? I did put in my mic, but I'm not
Yeah.
sure. Okay. Okay.
Yeah, it's good. It'll be even better. Hey, my little dog she likes to come in my office. So I put a blanket down for her, but she's trying to decide.
What
Oh,
she's
what is
gonna
it?
do.
I'm sorry, 1 second. You want to be. Oh, yeah. Hold on. You want to be up there? 1 second. All right. Yeah. All right.
And you're doing this in video now too. So I was just curious, like, do you post it on your website as video audio, or how does that work?
Yeah, so the entire audio interview, just audio only, is posted like it always was on whensciencespeaks.com plus all the platforms, Apple Podcasts, Spotify, all that. And then, and this is why I'm eagerly anticipating the arrival of my summer intern. He will create shorts. So if you go on YouTube, I have a YouTube channel.
Mm-hmm.
So there are clips like from the podcast interviews, like the sound bites, and some other stuff I've been doing, just some opinion pieces. And so the idea is that if there are 2 to 3 sound bites perhaps per episode, that those will be turned into YouTube shorts. So, less than a minute, and
Awesome.
go up on the YouTube channel.
Okay, perfect.
Yeah. All right. So, all right, everything sounds good, looking good. I'll read a brief sponsorship message and then your bio, and I have the most recent one. I shortened it just a little bit.
Yeah, totally.
All right. And let's see. All right, cool. All right, we'll go in 3, 2, 1. Well, hey, everyone, it's Mark Bayer, and you are tuned to When Science Speaks. This episode of the show is sponsored by OneSkin. Led by PhD scientists dedicated to helping people age in a healthy, vibrant way, OneSkin patented the first protein building block scientifically proven to reverse skin aging at the molecular level. Listeners of When Science Speaks receive a special 15% discount off of an entire OneSkin order. It's any products, no minimum purchase. And if you haven't yet experienced OneSkin products and decide to subscribe, you'll get a first-time subscriber discount plus an additional 15% off your subscription with the special Science15 code just for When Science Speaks listeners. Just go to oneskin.co and use the promo code SCIENCE15. That is the word science followed by the number 15 at checkout. And we'll also have a link in the show notes. I am so pleased to welcome back Dr. Amelia Burke-Garcia. She is an award-winning digital health communicator and researcher with 20 years of experience. Amelia currently is a program director at NORC at the University of Chicago, where she worked under CDC's COVID-19 response to build and direct the award-winning How Right Now campaign, which aims to increase people's ability to cope and be resilient amidst the pandemic. She is also the author of the just released great book, which we'll be talking about in just a moment. It is called Communicating Through a Pandemic, Influencing Health, a Chronicle of Experiences, Lessons Learned, and a Vision for the Future. Amelia sits on the boards of the national nonprofits Vaccinate Your Family and the Global Alliance for Behavioral Health and Social Justice. She's been featured by the U.S. Surgeon General, Dr. Vivek Murthy, for her work in honor of Women's History Month, and named verywellhealth.com's list of been named to verywellhealth.com's list of 10 modern female innovators shaking up healthcare. Amelia earned her PhD in communication from George Mason University, a master's degree from Georgetown University, and a bachelor's degree from McGill University. Welcome back to the show, Amelia. I'm so excited to have you here.
Thanks so much, Mark. It's great to be back.
So I want to start by asking you about your book and the major themes that you would like readers to come away with after reading it.
Yeah, so I think that there are probably 3 main themes, although I cover a lot of topics in the book itself. So readers may find a lot of different things useful throughout it. But I think for me, the three main themes of the book are that we shouldn't be surprised by the emergence of the COVID-19 pandemic, that it follows in this long line of other pandemics that have come before it, and that outbreak, epidemic, pandemic response and surveillance and management is an active part of the public health system, and that we should be prepared for, you know, future pandemics to emerge. I think the second main theme is that although we shouldn't be surprised by the COVID-19 pandemic, and we've all experienced the COVID-19 pandemic and similar aspects of it, we each have had our own unique experiences in this pandemic. And so the theme of sort of context matters, where you live, what job you do, how much money you earn, the color of your skin, the kind of information you are exposed to and trust for, where you get your information, where you get your knowledge from, the voices that you trust and the voices that you listen to. All of those things have been really unique depending on a lot of factors. And our experiences, therefore, in how we have moved through this pandemic has been very unique and individualized. And I think the third and final theme is really that I think we've learned a lot through this pandemic, and I hope we don't forget some of the really key lessons of this pandemic, lessons related to health disparities, lessons related to challenges with communication. But I think we have to do a lot more work. And I think it has really raised in our consciousness the importance of investment in public health infrastructure, investment in training, the importance of really, how we approach communication during these emergency situations. And from a health equity perspective, we are not all starting from the same place. And so therefore, people struggle differently in times like these. And so we really have to be thoughtful around what we need to do better next time and in preparation for next time, so that we can start to really address some of the issues that have arisen and sort of come to arisen in our consciousnesses during the COVID-19 pandemic.
Yeah, it's so interesting. I'm so glad you underscored the fact that it seems sort of like, well, it was a global pandemic, everyone experienced it, but everyone experienced it differently in their own way for these factors that, based on these factors that you're talking about. So that is such a key point that you don't hear a lot about generally out there. The other thing that I'm just sort of wondering about is if we kind of expect maybe every 100 years or even fewer now, that we could have something on this scale. Part of it is like, how do we prepare with an eye towards things are not going to look the same as they do now? Like it could be 100 years from now before we have something on this scale, and trying to project forward and incorporate that into lessons learned.
Yeah, I mean, I think that, two things that relate to that I touch on in the book are, first, in my adult lifetime alone, we have been through several pandemics, and they haven't been at the scale that we had with COVID-19, but they all required a certain level of response. They all required, support to certain communities who were going to be most affected. And I think the idea that this is something that happens once in a while, and therefore you don't have to prepare and create the support and infrastructure for when you're not in a pandemic, is something that we really need to rethink. I mean, I think there just needs to be more focus and more ongoing support and understanding around how do we prepare for these, so that the next time something does happen, we aren't showing up on people's doorsteps, virtually or not, asking them to do things like wear masks and get vaccinated and socially distance, and expecting them to listen to us, but we haven't been on those doorsteps in the past. So I think this idea of preparation and understanding, and yes, virus and infection surveillance is important, but also really beginning to kind of invest in communities and community outreach partnerships with communities, so that we can understand what people are thinking, believing, worried about, as we go into these situations. Like, we could be better prepared in terms of how do we get our messages out? Who do we need to be working with already and have relationships established already, in order to get our messages out, in order for those messages to be attended to and trusted and believed. And I think, so again, COVID is sort of one pandemic in a long line of other pandemics that have come before it. I also just think that, rethinking some of the frameworks or tenets that have historically driven our response communication. So there's a model I talk about in the book called the CIRC framework, and that's the crisis and emergency response communication framework. And in that framework, there are key tenets. And one of those, just as an example, is to be first. And while I understand what that means in theory, I think in today's media environment, being first is challenging, because we live in a world where information is driven by algorithms of things that you already like. We subscribe and we follow people, and so we receive information that comes to us based on what we've chosen to. We're not sort of inundated with information that we necessarily don't want to see anymore, the way we may have been 10, 20 plus years ago. And so this idea of being first is quite, I think, laden with problems in terms of, in some ways, agencies like Centers for Disease Control and Prevention, other agencies within the federal government, state and local health departments and governments may feel like they're first, but how we get our information comes through so many different channels that they may or may not really be first. And in that case, even if you are first, but you're not well trusted, it doesn't really matter anymore. So, the idea that you are still going to go to other sources to cross-check, to verify, to feel like you are doing your own research, I think those are all things we're seeing people do right now. And we need to be really then thoughtful about, does first matter anymore? And are there other tenets we should be kind of considering bringing into some of our planning frameworks so that we can really address the realities of our communications environment today?
Yeah. As a political person, I look at the pandemic and I think we had a playbook. We had a great playbook. It's like 450 pages of knowledge that CDC had put together, but we didn't have the political will to actually follow it. And it concerns me because, particularly in the early days, you can have the best plan on paper, but it does need to be implemented. And with the political interests that were flying around at the time, it was more about ideology, really, than it was about epidemiology. And I don't know how you control for that, particularly in an environment where there is so much mis and disinformation around. And of course, we're going to have more and more realistic disinformation and video and all of that stuff coming around. So all such rich topics. And we've discussed this, you and I, in the past, about misinformation, how to combat that, where it's going to look like tame, I think, in comparison to the situation that we're going to be moving into. I want to get to also, as you think about, we're talking about messaging, and there's a fascinating chapter in the book that I found particularly fascinating among the other works in the book, which is the 5 stages of messaging, and just the way you parse and explain the evolution of how the pandemic was messaged. It's just so insightful and instructive. And I'm wondering if you could share that with listeners.
Yeah. So, one of the things that I thought about as I was writing this book was all of the messaging and, mixed messaging, confusing messaging, changing messaging that we have all been exposed to in some way, shape, or form, right? So no matter who you follow, what channels you watch, what you listen to, COVID response messaging has been part of our our communications environment since 2020. Actually, since 2019, and that's where I start in that chapter. And so what I really wanted to think through and look at was what messaging were we really exposed to, and how did that messaging change over time. So in that chapter, I take us through kind of some of the early messaging that happened in sort of late 2019, kind of pre-pandemic, before COVID-19 was officially declared a pandemic. And as I move from that phase, I then move us into the other phases, such as where we had to move into stay-at-home measures, and what kind of messaging we were exposed to around there. And from there, I move into messaging around, return, sort of like the return to being able to go out again, normalcy kind of, and in those stages, we were really seeing messaging that revolved around some of the economic struggles. And so how, in that, with the idea of let's social distance and let's close things so that we could stop the spread. Of course, everyone is well aware now that had very severe economic impacts. And so this tension between the economic survival of people and the, biological or physiological survival of people we were really feeling that during that time. I talk about the mask debate and how that emerged multiple times over the course of 2021. And then I talk about other messages that we were receiving around the rollout of the vaccine. Some of the as other new variants emerged from, as we saw Delta emerge and then Omicron, new vaccines for kids emerge. And so I just sort of take the reader through what was going on at that time, what were we hearing in the news media, what were we being exposed to. And I think one of the main takeaways from that is, we have been exposed to a lot of different messaging over a relatively short period of time. I think the topics of stay-at-home measures, return, and then sort of the new variants, it all happens within a handful of weeks to maybe months. But we have to remind ourselves how much we went through and how much we were exposed to, because it was a lot and it was confusing for people at times. And it's a real record, I think, of kind of everything we've been through since sort of late 2019 on.
Yeah. Are there sort of threads that you notice as you started looking at the evolution, or maybe even like the mutation of the message through time?
Yeah, I think the mass debate is probably the easiest place to sort of point to when it comes to challenges with communication in this environment, right? So there were things, wearing of masks is not a new mitigation strategy, right? It's been something that has been used and recommended in other pandemics, certainly in other countries. It's a well-used mitigation strategy for just reducing infection spread overall. And I think when there was sort of an initial request to wear masks, but then what ended up happening was there were shortages there. We saw a lot of panic buying. And so what ended up happening was, while masks could be effective, they were really required, most importantly, for healthcare workers and people on the front lines. And when those people, when we needed to protect the available supply for those who are most at risk, the idea of wearing masks, we could sort of roll that back a little bit. It was sort of, we didn't need to, we wanted to tell people you don't need to wear a mask. In addition to that, we were, starting to see the rollout of the vaccine. And so we wanted to encourage people to get vaccinated. And so based on data, there were recommendations to wear masks. There were recommendations that if you got vaccinated, you didn't need to wear a mask. And so that was sort of with the attempt there was to help make people aware that vaccination could protect you, and therefore you would actually have sort of added benefits of not having to wear a mask. Well, then the asymptomatic cases started to show up. And so what we realized is that people could be, they could be infected, not knowing that they're infected, and spreading the virus. And so masks were again recommended. And then as new variants rolled out, that created new challenges. So, I think that the mask wearing debate was extremely challenging to communicate, and it seems like it should be easier, and it possibly some of the learnings from this pandemic could lead to better communication about similar kinds of strategies in the future. I do think that there were things that the public health community was learning as we were going, that really meant sort of about faces in terms of, or they were perceived about faces in terms of recommendations and messaging. And one of the things I think we'll talk about in a few minutes is sort of the challenge in a pandemic is that, the virus is moving very fast. And as communicators, we need to be able to message almost as quickly. But science and evidence-based science moves slow. And so, figuring out how do we message around some of these topics that may shift very rapidly in a situation like a pandemic is very critical to being able to share information with confidence, but recognizing that things are going to shift, and they're going to shift quickly, and we need to be very transparent about that.
That's the point that I want to make. Excuse me. And it's that point that I really want to underline is I think that there wasn't the expectations management piece of this that was given that much thought. At least it wasn't clear to the public. So even starting out by letting people know, look, like you said, this is a fast moving, sort of never before seen virus, and there are going to be changes, and we're going to be learning, and we're going to be, reacting, and we're going to be on top of it. But there may be some information that has to be changed or even pulled back as we learn more. And I think maybe if that had been more transparent, perhaps plus something like, nonetheless, you may hear people telling you that you should do, use whatever it was, again, we're operating in this political environment that was really competing in many ways, trying to frustrate messaging with competing messaging that was wrong. But nonetheless, I think maybe from communities and actual experts talking about this, sort of like pre-bunking some of this stuff. People may tell you with certainty that you should do X, Y, Z when there was no basis, in fact, of taking a certain medicine, for example. But they don't really know what they're talking about because this is a fast-moving thing. We're using actual scientific methods or whatever. I just don't feel there was the expectations management aspect of this, which then led to cynicism without that, as things had to be adjusted, but they had to be adjusted based on the science, of course. And all the while, this is happening with competing narratives, that are being pushed that were undermining the actual public health messaging. So just a huge cloud of things happening and moving, like you said, at such a fast pace. I want to ask you, Amelia, about who this book can benefit. Who should make sure that they read this book?
So I think that this book is probably primarily of value to public health practitioners, communicators who are working in this space, who may find some of the historical pieces or the analysis of what we've been through, some of the data I share, helpful in their work. Some of it may not be new to them. Other pieces may be new to them. Either way, I think it serves as a nice record of what we've gone through from a communications perspective. That said, one of the things I tried to do with this book, and it was a similar approach that I took with my first book, is to leverage storytelling as a way to anchor the points that I want to make throughout this book, the data that I share, the lessons learned. And so this book is rich with different anecdotes and stories from people that I have met and talked with, stories that I have read, and others have shared with me, and memories of that time, from my own personal experiences as well as from others. And I think it's important to note that, because from that, if when you consider that, I think that there could be value in reading this book, even if you're not working in public health, but maybe you're working in an area of crisis communication, or you're working in an area of political communication. And if you just, want to read more about, how to think about what we've been through, I think what we've been through is quite tremendous on a number of levels. And one of the reasons I wrote this book was for my own sake, to begin to process what we've been through. And I wanted to think through like what that pandemic story looked like, for myself, but as well as for others. And so I do think that other people will find value in reading this book and thinking about what their pandemic story really has been.
Yeah, and I want to ask you, Amelia, about this as you were delving back through and digging through and researching and analyzing for the book. What surprised you? What was maybe inspiring or terrifying? What did you what were some of the emotions that you went through as you were looking back at what we've experienced so far in the pandemic?
I think, again, I think what we have all been through is, when you think back on 2020 into 2021, it is really kind of unbelievable that we have been through that we have spent weeks, months away from loved ones, from friends, from activities that bring us joy and self-care. I think that when you look at the data, in some ways, writing this book, it was a little depressing, right? The realities of how many different groups of people really struggled throughout this time. There's a whole chapter on audience group experiences, and I do highlight a number of different groups, some of which I think have been in the media quite a bit. Of course, our healthcare workers really struggled, and continue to struggle. The LGBTQIA community has really struggled, but I also highlight people experiencing homelessness, justice-involved individuals, migrant workers, other groups that I feel like maybe don't get discussed or acknowledged as much, and oftentimes, those are folks who in our society often live in the shadows. And so really trying to bring out both their experiences, but also some of the data to support their experiences, and the points around lack of data, right? So for some communities, there's just a real lack of information because the data collection methods are not there, or they just aren't consistent, or keeping a record of what people have gone through is harder or tougher, or just not done. And so I think it is meant to be to remind us that this has been hard, and there are lessons to be learned, and we need to do better by people in our communities as we move forward. That said, I do hope that the way that the book comes across is ultimately with some hope and some recognition that while the public health community took a lot of hits in the media, a lot of critique from people, the people that I have worked with, they gave up so much of their lives over the course of this time. And yes, was everything done perfectly? No. Could we do things better in the future? Absolutely. But I do have to recognize their contributions and how much of their lives they gave up, and really what they sacrificed in service of others during this time. And so I wanted to recognize that, and also, sort of lay out, yeah, we have a lot of work ahead of us, but I do believe we can get there with the right investments in the right areas of focus.
Wonderful. Let me ask you as we wrap up, what's next for you? What's on the horizon? What do you see in the public health space, in the ecosystem in which you're working that's emerging?
Yeah, so I think, again, in the spirit of like good and bad, I think there are a lot of challenges ahead of us that we have to really acknowledge and work on. Some of which I talk about, we've talked about today. I talk more in the book about, relative to embracing a more nimble and responsive communications culture, being more inclusive in how we understand community needs, making sure that the right voices are at the table. But we're also on this precipice of everything just getting more complicated too, right? So we've got AI that is generating images that can lead to increased mis and disinformation. We've got issues around, copyright and who owns this content and how do you use this content. We've got social media platforms that are constantly emerging and shifting and changing, and that is making it in some cases harder for researchers to understand what's going on in those spaces. It's also meaning that some of these platforms are maybe more limited in the United States, or limited in other countries, seeing sort of a growth of followers with particular belief systems, and a loss of followers with other belief systems as people kind of increasingly seek out information that supports their pre-existing beliefs, and ideals and ideologies. And so I just think we've got a lot of work ahead of us to figure out, and we need to be getting together, making the right investments, bringing the right voices to the table from a mix of perspectives, and looking to see how we can work together to solve some of these problems, because they're only going to get more complicated as we move forward. Right. So there's a lot of work. There's a lot of work coming up.
Yes, thank you. And thank you so much for this important contribution. Your book, Amelia Burke-Garcia's book, is Communicating Through a Pandemic, Influencing Health, a Chronicle of Experiences, Lessons Learned, and a Vision for the Future. Dr. Burke-Garcia, thank you for everything that you do in your day job, all the important insights that you're bringing to the table, the analysis that you're providing to the public, just so important. And as you're suggesting, it's going to be almost increasingly important to get these voices and this information out as other forces try to cloud the issue, perhaps with information that just is not accurate. So thank you for the work that you do.
Yeah, no, thank you, Mark, for having me. This was a great pleasure. And until the next time.
Right. Wonderful. And listeners, thank you for being here on this episode of When Science Speaks. And I hope you'll be back next time for the next episode of When Science Speaks.